I like to educate my patients. I give them, a few options in their treatment, but any questions that they have with it, I'm going to answer them straight. I want to treat them like they're my family. I don't want to treat them like Chat GPT would or whatever, like straight from the book. I want them to be like, hey, I can have this conversation with you about this treatment. What would you do? What would you do if it were you? And so, yeah, that's kind of where I'm at. I know my dad, we're from southeastern Kentucky, so it's definitely changed a lot from coming from where I am to a bigger city as well. But it's great because people are more educated on stuff. It's just obviously not to the extent that some dental professionals are. But that's what we're here for. That's why it's our job. We're here to help you.
And sometimes it can be tough because, like, if people are watching short little TikTok blurbs about a topic, right, and they think they're informed, but they get just one tiny piece of information without the context of that information, and then they form an opinion that's not really accurate, but then they come in with a wrong expectation. That can be challenging.
Or they
sometimes.
hear it from a friend too, like, "Oh man, root canal so bad."
Yeah.
Have you had one?
No, but I saw them.
Yeah, it's not bad.
Yeah. Or like the patient, all the videos of being filmed in the car when they have their teeth extracted. I mean, like all those.
Still
questions.
under the
Hey, those are great. Come on.
They are.
You gotta have fun with it.
Jeremy, Macy, and Natalie, welcome to the Content Studio. How you doing?
Good, thanks, John.
Absolutely, it's so good to have you. This is a little bit of a unique situation. We asked you to leave the dental practice and spend a day here with your team, and we're doing all kinds of fun things, right? Took some photos this morning, and so everybody will get to see those. Very traditional, very formal, so I'm excited for very professional. For those in the community of the Louisville and Southern Indiana area to learn more about Cornerstone. But in all seriousness, it's absolutely great to have you all here. And if you would, maybe just a little bit about yourself, and then with all three of you, I want to kind of get into some clinical discussions this morning and really want to get all of your perspective of like how things are different with patients now, like how you guys are dealing with patients when they're coming into the dental practice and all the good stuff. So Jeremy, we'll start with you.
Yeah, sure. Okay, so how do I treat patients when they come into the dental practice? Usually with good humor.
Yes,
that's the main first thing is, I tend to recognize that the dental office is not everyone's favorite place. You do have people who are like, oh my God, I love going. I feel great every time, but that's like, once a month you meet that person.
Right.
Most other people are like, okay, it's something I've got to do, or they're really dreading it. And so just trying to keep in mind that, they're there oftentimes with a problem, and we need to try to do something to alleviate them of whatever problem they're having. Or if they're just there because they don't have a problem, they're just trying to stay healthy, help them stay healthy. If we see stuff that they need help with, do it, and then just do it in good humor and in a relaxed environment, and try to just make it as easy for all of us as you can. And that's kind of how I look at things.
And Macy, you've been practicing dentistry for 3 years, and you went to UK dental school, right? Right. So all the UK fans are going to be super excited. You got the blue on today.
Go Cats, we've got a game tonight.
If someone is a U of L fan, they can still come to the practice, obviously.
Absolutely.
But in all
we might treat you a
seriousness,
little. I'm just joking.
it's great to have you here. Yeah.
Thank
So
you.
I mean, you've been practicing for 3 years. Like, just talk a little bit about what it's been like to get out of school and then more importantly working on patients.
Yeah. I mean, it's just great to be able to put it into practice. It's something that my family's been in the medical field their whole life, and so I've always had it instilled in me, just like help others, treat others, the way that you want to be treated. And like you were saying, when people come to the dentist, most of the time they're in a very vulnerable position. So I want them to be able to come to me and be like, I'm not scared anymore. I want people to change around their perspective of that. My husband, when he was younger, he had a very poor experience, and so he didn't go to the dentist for almost 17 years. Oh, wow. And so I kind of get when patients come in and they're like really scared. It's a very vulnerable time. And my goal is to make them feel as comfortable as they can. And when they leave, I want them to be like, wait, I want to come back. Yeah. In a lot of places, it is hard. It is a hard position to be in, but I love it. I love making people feel comfortable.
Awesome.
Yeah.
So Natalie, I've said over the years that with what you do on the really kind of clinical lead assisting side, is you're like the air traffic controller, right? Like you make sure that everything, is that a good depiction of what you do as a dental assistant?
Yeah,
like, you make sure that things move smoothly, but
yes.
talk about patient care from your perspective, and you know what it means to you to make sure that you know these patients are coming in and getting the work done, because you get to see a little bit of a different side of it.
I guess we always just want to make sure that they understand the procedures that we're doing. We try to walk them through step by step and talk to them and make sure they know that they can stop the procedure at any time if they feel uncomfortable or if they feel pain. So we just are all about making sure they feel comfortable and they're relaxed and in a safe environment for them. And comfort is our main priority with them.
Jeremy, I've had the opportunity to spend some time with some of your patients who were willing to, you know, talk a little bit about what the experience has been like. But what's it like for you when you do bring them in, you're able to lower that wall down a little bit of anxiety, and then have them get the work done that they need to get done? Talk about that a little bit.
Yeah, I mean, you know, it really can be a challenge. It depends patient by patient, of course. Different people have different tolerances for different things, and they have different needs, you know, both dentally but also emotionally, and just who they are as individuals. And, you know, identifying that and then working and meeting these people where they are and trying to just help them with the stuff that they know they need, but also maybe with stuff they don't recognize that they need yet, that's probably related to the reason that they're there most of the time. You know, there's always that first step, you know. I mean, it's a new relationship. You're meeting someone for the first time. You know, they come in and then you're expected to do something for them and do it well. And they don't love to be there to begin with, but they are. And now you've just got to do something, right, to improve their situation in some way, whatever it is that brings them there. So getting past that first step and that challenge of meeting that person, and then, you know, like Macy said, hey, they're in a vulnerable position, and trying to, you know, just get to that position of trust and comfort and that rapport, you know, to help them is really the main thing. And once you do that and that relationship is built, it's so much better, you know, from that point forward.
Absolutely. Macy, I know you've been practicing for 3 years, but you've had, like you said, medicine in the family for a long time. How is today's patient a little bit different, maybe when they come into the practice, as far as like their knowledge, lack of knowledge, like maybe what they know, like what the things that they look up online. So like, how have you been able to kind of manage that? Because it really is different. Yeah.
Online, internet, social media. People come in, they're like, have you heard about this new thing in Japan? They can grow their own teeth now. And I'm like, yeah, let's keep researching that. I don't know that you want to be the guinea pig. So there is that social media aspect where they come in with expectations, but they still hopefully are curious. They come in for us to help them. Otherwise, you know, they're going to go online and get their own stuff from Amazon if they want to. I've seen it. It happens. It's okay. No judgment, but we are here to help that. I like to educate my patients. You know, I give them, you know, a few options in their treatment, but any questions that they have with it, I'm going to answer them straight. You know, I want to treat them like they're my family. I don't want to treat them like Chat GPT would or whatever, you know, like straight from the book. I want them to be like, hey, I can have this conversation with you about this treatment. What would you do? What would you do if it were you? And so, yeah, that's kind of where I'm at. I know my dad, we're from southeastern Kentucky, so it's definitely changed a lot from coming from where I am to a bigger city as well. But it's great because it's more, people are more educated on stuff. It's just obviously not to the extent that some dental professionals are. But that's what we're here for. That's why it's our job. We're here to help you.
And sometimes it can be tough because, like, if people are watching short little TikTok blurbs about a topic, right, and they think they're informed, but they get just one tiny piece of information without the context of that information, and then they form an opinion that's not really accurate, but then they come in with a wrong expectation. That can be challenging.
Or they
sometimes.
hear it from a friend too, like, "Oh man, root canal's so bad. Have you had one?"
No, but I saw them.
Yeah, it's not bad.
Or like the patient, all the videos of being filmed in the car when they have their teeth extracted. I mean, like all those
still
questions.
Under the
Hey, those are great. Come on.
They are.
You know, you gotta have fun
entertaining. They are entertaining. And then, but you're right. I mean, that's why I wanted to bring it up, because it is the world that we live in now. It is something that you all deal with all the time. But I know we talked about this. We thought it was really important to do a day like today with you and your entire team, so that people can get that other perspective, right? I mean, if people are going to be learning about a dental practice on social media and online, let's make sure that, you know, like you mentioned, you know, we educate them, which is awesome. All right, so Natalie, a lot of times you're with the patient, Jeremy or Macy come into the operatory and then they leave. So sometimes do you get those conversations like the patient going like, okay, they recommended this, like, should I do this? Like,
Yeah, we actually had a patient the other day. She was just, I guess they want, like, they don't see us as like the doctor.
Yes.
Doctors are serious. We're not as serious.
Yeah.
So I have had patients kind of ask like, what do you think I should do? And I try to give them the advice that I would give like my mom or dad or my sisters. Like I wouldn't just say, oh, just do this because,
Right.
you know, I would make sure it was something I would give the same advice to like my own family
Sure.
on doing. But yeah, that definitely does happen.
Yeah.
Yeah.
Well, and we're going to spend some time with, the team up front and have them their perspective, right? Because it's like they talk with you all, and then they talk to Natalie, and then it's a third thing, right? When they go to the front, like, okay, everybody in the back told me that I need to do this. Like, do
Yeah.
I need to do this?
Yeah.
You know. So, but more importantly, how do you when you think about some of the patients when they come in and they're in pain? Talk a little bit about how you like to approach that, right? Because, I mean, it's first and foremost is to really kind of lower that anxiety and educate them before you can, in a lot of cases, I know, do anything at all.
Yeah, I mean, it kind of depends on what kind of pain are they having. There's people who have fractures of teeth, and they're miserable, and there's literally nothing you can do for them except anesthetize them and remove that thing. But there's people who've been in chronic pain, and it's been there for a while, and they've just got a big abscess, and there's pus draining out of their face, and we don't like to take teeth out when they're like that because a lot of times that infection, once you remove the tooth, it can spread through the body and it can cause other problems, especially if they're medically compromised in some way. So a big part of it is, hey, how can I relieve you of the condition that brought you here, but how do I do it safely to your benefit? And if I can't help you today, what can I do that's going to make it better? A lot of times it's, listen, you have a bad infection right now. I've got to get you started an antibiotic. Within 24 hours, you're going to start feeling relief, from that, because that swelling, that infection is going to start dying off, okay? And then come back in a week, and we'll be able to do whatever. If it's a root canal or an extraction or whatever it is, then we can take care of the source of the problem, but we've got to knock that active infection down. And that's a very frequent scenario. But then you've got, again, the person with trauma and just something that's completely broken, not fixable. Yeah, let's numb you up and get you out of pain. Then there's the people that come in there in so much pain you can't even look at them, and we'll get them numb just so we can go through and check them and probe them and get them, to where we're not torturing them, because it's not what we want. We want them to be as comfortable as we can get them and help them, and get them through this particular thing. So that's primarily how we address those.
Macy, you talked a little bit about how important education is to you. I'm hoping that more and more patients are aware of the oral systemic link, and that people have recognized that the head is connected to the body, right? It's not going anywhere. And the things that happen in the oral cavity can affect the rest of the body. It's interesting, like 7 or 8 years ago, I had a chance to interview a periodontist, and we were talking about the oral systemic link, and he was like, oh, like, as dental professionals, we've been talking about this forever. It does seem like a little bit, and I'm curious on your thoughts, that maybe since COVID, I don't know, that patients are a little bit more aware and are putting 2 and 2 together on how important it is to make sure that you're doing preventative stuff, here to connect the rest of your body. How are you seeing that?
I think to an extent, yes. A lot of people are like, it'll never happen to me. That's kind of what I've got until it does.
Yeah.
I've seen a lot of young people. I actually have a family friend who passed away because she had infective endocarditis because she had not taken care of her teeth, done some things she shouldn't have, heart got bad, died at 27.
Oh, my God.
And it's so sad. It's so sad because a lot of people aren't educated. And if they are, like I said, they think it's not going to happen to them.
Right.
I'm not saying anybody who has an abscess is going to go through that. That's not what I'm saying. But we want to help you. Don't be embarrassed if you've not been to the dentist for 15, 20 years and you're like, oh my gosh, I have all these abscesses everywhere. My teeth are all rotted out. I can't go to the dentist. They'll be judged. No, absolutely not. That's what we're here for.
Right.
And so, yes, to an extent, I do feel like people are a little bit more educated, but at the same time, you know what I mean? Like they say, it wouldn't happen.
What are some things that either you are doing or some things that you all can do as patients are coming in to, I mean, listen, sharing a story like that is real, but until they come into the practice, like you mentioned, even make that decision to come in, you don't get a chance to share that story.
Right. Well, fortunately, Cornerstone has a lot of outreach opportunities. And kind of like what we're doing today, we want you to get to know us. Like, we're here, we're people just like you. We've got families, we've got friends, we got teeth to take care of
You got teeth too, yeah.
You know?
They have teeth. It's
Like,
amazing. You know what I mean?
yeah, maybe I don't floss as much
never
as
thought
I should,
about
but,
that.
you
And
know,
they're real.
whatever. Nobody
They're
said
not
anything.
Tybodons. They're actually real.
Yeah.
You know what I mean?
So, like, we want you to get to know us so that you aren't scared to come in. Like, going to the, sometimes I'm scared to go to the doctor.
Right.
I don't want to go. I don't want them to tell me something's wrong with me.
Right.
You know, but it's your life. You get one life. You got to take care of yourself. You got to take care of yourself for you and for the people around you. And oral health, 150 million % is connected systemically.
Yeah.
Snoring, teeth grinding, anything along those lines. It all can affect who you are and your quality of life. What was the question?
Yeah,
Well,
that was
okay,
it.
so
No,
but-
I mean, that was awesome. That's kind of what I meant. Is just
I forgot
that.
where I was going.
No,
with
Is
no,
that-
but well,
yeah.
what I was going to say,
Yeah.
just to help, that along is the number of people that come in who are poorly controlled diabetics.
Yes.
But they have perio disease, right?
Yeah.
We treat the perio disease, all of a sudden their blood sugar is well controlled.
Yes,
Right?
absolutely.
It's like the one thing that was really keeping them back. We see blood pressure gets worse on people who have perio disease. And then these studies that now come out all the time, and I see people link them on, social media, like, hey, did you realize that strep mutans, is associated with different brain diseases,
Right.
Parkinson's and Alzheimer's, and different types of dementia, et cetera. So yeah, this is directly connected to stuff
Yep.
that's happening. It's not the primary causative factor in most cases, but
100%
anything
plays a
else that
role.
they're living with
Yeah.
is worse.
Yeah.
And so being able to take care of this and get this healthy helps everything else,
Absolutely.
be better.
No question. So, Natalie, as the air traffic controller, you get an opportunity to work with a lot of the patients that come back. Like I mentioned, just in some of the conversations I've had with some of your patients, they shared what the initial visit was like, getting them out of pain, and all the work that you all did to do that. But then on the other side of it, they talk about now how seriously they take their oral health and prevention and the flossing and all that stuff. Do you see that? Do you see that with repeat patients? Like when you all are able to get patients that come back to the practice after you've been taking them out of pain and you've helped them, what do you see? Like, do you see them taking a little bit more serious from your perspective?
Yeah, I think so. And Dr. Bewley's really good at educating the patients and kind of talking to them in a way they understand. So I feel like they do start taking it more serious and realizing that it affects a lot more than just your smile, and it is an overall health concern.
Yeah. Jeremy, what is one thing that you wish patients knew more about the work that you do that, is still kind of a little bit of a mystery when it comes to dentistry?
I was just thinking when Natalie was talking, I think one of the things that I love the most is when a patient comes back and they say, I was sick and I didn't know it. I was so used.
Or like their color when they
Yes,
first came in
they
was
were
like
gray,
pale, and
yes.
then they come back again and they just have like
They're standing
life
up
to 'em.
straighter. And
Yeah.
they just look
Yeah.
better. But just, when people give you that feedback, I was sick, now I'm not sick. I was sick, I didn't know it until this one thing brought me here, and now we've kind of done this. I was just chronically a little bit sick forever, for 20 years or whatever. And then you take care of whatever it was that was bothering them, and all of a sudden they're like, oh my God, I have energy.
Yeah.
I'm sleeping better.
Yeah.
I feel better all day. My blood sugar's under control for the first time in 15 years or whatever it is. I mean, things
Yeah.
of this nature. It's just, I think people don't know necessarily how much dental problems can affect their day-to-day lives. And oftentimes there might be pain for a little while that goes away. Well, it went away because the nerve in the tooth died. Now it doesn't hurt anymore. But now it's a chronic source of infection. And so they're just walking around with this draining somewhere into their body.
Yeah.
And they're just used to it.
Yeah.
And they don't realize that, that's really affecting them. It's not just a tooth problem. It's affecting their lives. It's doing other things to them. So I think if there's one thing I wish more people knew up front and didn't have to get to the point where we're doing something for them to get them to that realization, if they just understood that, these problems are affecting them.
And they're preventative.
Yeah.
Correct.
They are.
Yeah. So, Macy, I want to shift gears a little bit, talk about technology.
Okay.
And I know
Definitely my strong suit. You
Well,
keep coming at me with those, the social media,
because
the
I
technology.
know
You're so
I know,
young.
right? I just your face just says you want to talk about this topic, but in all seriousness, Jeremy's mentioned it. Like technology has been something that he's been committed to.
Yes.
For the practice, and I think so often you all know this as dental professionals, that there are advantages to the technology for all of you, for efficiency, for all those things. But what doesn't always get talked about is how that technology actually helps the patient experience.
Yeah.
So that's kind of where I wanted to go.
Yeah.
Is just kind of, have you talk about like the excitement of like where technology is in the dental practice and how it's making things easier for you all.
It's so amazing. I mean, there's so many things to talk about. I mean,
I knew it. See,
like,
she was like,
that's what I thought you were gonna go like phones or something. I'm like, listen, I'm maybe 30, but I'm in bed by like 9 o'clock, so can't do phones. Okay, let's go. CBCT, 3D machine, scans your face in 3D. Okay, if you're looking at just a regular X-ray that dentists take on a regular, it's 2D. It's flat. So you could have a tooth there that's got 4 roots. On that 2D X-ray, it looks like 1 root, 2 roots. So you could easily be missing something, right? Or say you come in with that same tooth and there's infection there. You're wondering, can I save this tooth? Oh no, let's get the CBCT out. Is it fractured? Can we treat it with a root canal? What do we need to do here? And you can do that. You can figure that out same day. That way the patient doesn't have to come back, be in pain any longer. More things. You've got the 3D scanner, 3D printer. You want to come in, you broke your front tooth off. Great, let's do a root canal, get your tooth there today. You don't got to worry about going to the lab. You don't got to worry about waiting 2 weeks for a temporary, worrying about that temporary falling off if you're going to a Christmas party and you're like, I can't eat this steak because if my front tooth breaks off, everybody's going to know. It's crazy what technology can do, and it's really cool to think about what's next with it. Because I know 15, 20 years ago, we didn't think we'd be able to do a crown the same day, probably.
right.
So there's always something new coming, and Cornerstone has the best of the best. I have never seen anything like it. And then I think we've got an in-house lab tech who can make it look exactly like you want it to. You will never know that your front tooth was broken because it's going to look maybe better than before. So technology is really cool. More so just making sure the patient's taken care of. Hopefully, there are some situations, but hopefully the same day so that they don't have to wait on anything.
Yeah. I've been in dentistry for 20 years, and I have seen the gamut of continuing education courses that you all have to take on case acceptance, right? Things that you can say to the patient and things that will hopefully give the patient confidence to move forward with the treatment. But it does seem like, Jeremy, that with some of the newer technologies and like, Macy mentioned, like this different set of eyes or looking at things in a different dimension, I feel like it's added the confidence to the patient. That in addition to what you all say when you make a diagnosis, that they all say, okay, cool, like at least, I have this other, piece of technology
Well, you
that
can show them,
that can,
too.
you can show
Because
them,
you can't,
which are pictures
they can't
of worth
see what's
1,000
going on in
words.
their mouth.
And so like that's why I've been so excited for all of you.
Yeah.
Because I've watched in anguish over the years dental professionals like being frustrated about like wanting to move a patient forward and not being able to because for a lot of reasons, right? Trust, I can't see it. Big difference.
Right.
Yeah, I think the most obvious example, of that is when someone's been referred in for an implant, right? They've got a tooth that's not fixable, or they've been missing a tooth, or whatever it is. And I can do the surgery on that patient on the computer first. And I already know, hey, this is where the future tooth has to be. The implant has to be in this exact location to support the future tooth. Because the patient doesn't want the implant.
Right.
They don't care about the implant. What they want is a tooth, right? But if you can show them, hey, this is graphically, on the screen, this is where your tooth is supposed to be. And the implant has to be in this exact position to support in health that future tooth over time, because this isn't fun to do the first time, and you'd probably rather it go really well to begin with.
Right.
And so what we do is we do the surgery virtually. I'm able to show the patient, hey, we use a surgical guide, meaning once I plan this position, I can 3D print a stent that fits on their other teeth, and it directs the drill to within a 0.5 millimeter of where we place that implant on the computer, right? And so then if they're worried about, hey, there's the nerve that lives in the jaw that gives you sensation to your teeth and your lip. We don't obviously want to traumatize that. You don't want to accidentally put an implant into the sinus, for instance. Things of this nature, it's controlled, right? It's something that we can show them step by step how we're going to solve this problem they have. We're going to use technology, and they can see very clearly what's involved.
Right.
And I've already worked out all the most likely complications or issues for this particular case on a case-by-case basis. And that communication with that patient is fantastic. And so, I don't know that you have to worry about, hey, how do I talk to the patient about this case and why they need this, because when you just educate them and show them, it's all the talking you have to do.
Yeah.
And their questions are answered. It just makes sense to them.
Yeah.
Yeah.
Yeah, I mean, you talked about it, lowering that guard of coming into the practice. And I have always talked about this analogy between a dental practice and like getting our car fixed, right? If you don't know and understand what's going on underneath the hood, and you go in there and someone comes out and they say you need $457 worth of work, right? You're like, you're lost.
And it's
you're like,
because your blinker fluid is low, you know?
My car light came on this morning.
Right.
Oh,
Should
well.
I trust that? Like, is it real?
Yeah.
And obviously, you've been going to the same mechanic for many, many years,
Right.
and they've done the job. You trust, but that's not always the case.
Right.
And there's new patients coming in your practice all of the time. And so, yeah, I mean, I think that's what's so cool is that when they can see it,
Yeah.
it really adds. And I think, what is back to the education piece, like the confidence that they have, that now it's almost like they're involved in the procedure. Now
Right.
they can take ownership of their own health when they see it.
Yeah.
Like, that's me. That's my
Absolutely.
mouth.
Yeah.
Yeah.
People don't realize it. I mean, you can't see inside your mouth unless you're like looking in
Right.
the mirror, and still, even then, you can't see anything really.
Right.
So taking intraoral pictures, showing them, they're like, "Oh, that's my tooth.
Yeah.
That's a fracture in my tooth." Like, oh, and it makes them trust you more versus. I've never thought of it as the mechanic, and now I can't unsee it. But like, I'm the same way. I go and I've got my mind made up. I don't need a new filter.
Right.
I don't need this.
That's right.
Then you show me, and it's got like 5,000 rocks in it, and I'm like, how's my ear getting through there?
Yes. Yes.
Oh, okay. That makes more sense. Now I trust you. I mean, mouths are
Yeah.
vulnerable,
Yeah, completely.
I have people come in tattoos all the time. They're like, I'm not scared of needles, but when you put one close to my mouth,
Right.
no, absolutely not.
And last time I checked, when you walk into a dental practice, there's not a menu like McDonald's talking about the different procedures and what they
Right.
cost, right? I mean, we're obviously going to get into that with Amy. Just that's a whole other part of trust when it comes
It
to
is
how
a
you guys
big
work with
trust.
patients. But it starts clinically with all of you to make sure that they feel comfortable and that you're taking care, you're taking them out of pain and all that stuff. Natalie, I wanted to ask you again, like you get this different perspective to watch the patient's reaction after things are presented to them, and do you tend to see like them almost kind of like take a deep breath, like from your vantage point, like once it's presented to them that, okay, here's a solution. Yes, I've been in pain. Dr. Bewley comes in, he talks about them, what the solutions are.
Yeah.
Do you visually see them kind of like take a deep breath in the chair and be like, okay?
I think sometimes they can feel like overwhelmed, especially if they hadn't been to the dentist in a really long time and we're giving them this huge treatment plan and every tooth needs something done. And I think they get overwhelmed, but I just try to reassure them that we're not going to do it all at once.
Yeah.
We can break it up. We're going to do, what's worst
first,
first and kind of work our way through it, and we can time it out, and it's not going to be like all at once. And I always tell them, like, the first step is come in here and, starting the process. But yeah, they get overwhelmed at first, but I feel like once they get the process started, they kind of reassure themselves that they're okay.
Absolutely.
And yeah.
It's a common theme. I've heard you share it a lot when you and I have talked about your patients and the way that you run your practice, in the sense that you take this long-term approach, right? I mean, you say it often so that patients understand, kind of like what you said, that they're not necessarily going to have to get everything done at once. I think both on a clinical side, but then also on a financial side. I think that, as you all know, kind of takes a little bit of relief off that, okay, am I going to go in here today and to get this taken care of, I'm going to have to not only get over my anxiety, but I'm also going to have to figure out financial, which then just added a whole other level of anxiety.
And some patients want to get it all
Correct.
done. And, I mean, we can do
Absolutely.
the sedation, and they're
Yes.
super nervous, and we can just knock
That's
it out.
exactly what I was
Yeah,
going to say.
we
It's
can
like
knock
these
it out
people who are,
at all at one
good
time.
point.
But
Yeah.
we definitely have different options for.
And I
different
think
people.
actually one of the things I've loved about sedation, you think about some of these, especially like the veterans that we've seen, who the VA sends us, and they're struggling, and then they have to be sedated. They just cannot sit.
trauma,
Yeah.
They just can't, and so you have to sedate them. But then you get through a couple of visits with them, and they go, I think maybe I could try this without sedation. And they come in and they go from this really anxious ball of just stress and anxiety, and then they breathe and they relax, and then we're not putting catheters in their arms and
Right.
and sedating them, which we still will if they need it. We want to help them, but it's great to kind of see that progression, because as you go through and you build the trust and you build the relationship, they realize that, oh, this is someone who does care about me. They are working for me. They're trying to help me be healthier and get better. And then just seeing them breathe and relax, I think, is awesome. Like, I
Yeah.
love that.
Yeah.
And it just seems like it happens a lot where people
Yeah.
start off, needing sedation. And they realize that, maybe I can do without. And they go, yeah. And then they're just simple patients, moving forward. Like you get the worst of it done, and they're like, oh yeah, this is fine. It's easy. I don't know
and
what
then it makes us feel good because then they trust us,
Yep.
and it's like, oh, you trust us now. Like,
Right.
we're your friend.
Because it's stressful for us too when people come in kind of with that energy to them. I mean,
kind of rubs off. And
we're
just
trying
like,
so
we wanna,
hard for them, but it's stressful for us too in those cases. So getting through that is a step for everyone involved, not just the patient. It's us too.
Absolutely.
Yeah.
Natalie, we talked about this a little bit, and Jeremy, you mentioned it. Coming to a dental practice is not always what everybody is really excited to do, right? When you look at your calendar, you're like, okay,
Same. No,
I'm bringing that up.
It's just called work. It's just called work.
But I'm bringing it up because you all know this. I have just an immense amount of respect for all of you and the work that you do, because it's not easy, right?
Yeah.
And for any of us who've been in dentistry to know what you all do on a daily basis, it's not easy. And then you stack on top of that is that not always knowing if people even want to come see you all.
Yeah.
How have you been able to, as a dental professional, work through that? Like, how do you do that in your community? Just like, getting up every day, like coming into the week. Like, what are some ways over the years that you have been able to kind of work through knowing that?
Like knowing people don't want to come to the dentist. I don't know. I guess it's just like when that first visit, when they're like, I don't want to be here. And I'm like, me either. But then like towards the end, and they like actually enjoy coming in, and they're like telling us stories about like their daughter getting married or somebody having a baby, and then they actually want to come see us and like hang out with us and you like have conversations.
Finding a common ground with them.
Yeah.
I mean, you come in. Obviously, I'm not going to jump right into drilling your teeth.
Yeah.
Like I want to get to know you. I want to know what are you doing here? Why are you here? And building the rapport with them, like, it makes them feel much more comfortable, even if it's just 5 minutes of them getting to know you getting to know them. They feel heard, and that makes them feel special. They don't feel like they're being talked at. They feel like they're actually being understood for a minute, and they're being treated as they should, as a human, and not just a tooth to drill on.
And I think that's a big difference with like corporate dentistry and like private practice dentistry. Corporate's more, I guess, motivated by like the production and the money,
quick.
and
It's quick.
like our office isn't motivated by that. We want to, actually care for the patient and do what's right for them. So I think a lot of patients get traumatized by going somewhere that just sees them as a dollar and wants to get as much out of them as they can, and that can be traumatizing too.
Right.
And I wouldn't want to go somewhere either if that was how I was viewed.
Yeah. And a lot of people, I've had patients come in, they're older, they don't have anybody to talk to.
Oh, yeah.
And then you sit in there for 5-10 minutes just talking to them, makes their whole week.
Yeah.
And it makes mine too.
Yeah.
It gives you a whole different perspective.
Yeah.
Some days you're like, man, I got to get in and out. No.
And then you get that old lady who wants to tell you about everything, and then you just have to slow down,
and it's the sweetest
it
thing.
kind of makes you slow
It's
down.
the sweetest thing in the world.
Yeah, absolutely.
Do you ever have to tell her that, could you say it again? Because like she has a scaler in her mouth and you couldn't really.
That's the worst when I ask a question and I'm like, just nod yes or no.
Yeah, totally do that.
Because my father-in-law says that. Like he loves to go,
always
like
do
he likes
that.
to have a conversation, but he's always like, they always ask me a question.
Blink once for yes, twice for no.
Right.
Well, it's funny because we like to talk to people,
signs,
but
you
it's
know
so
what
hard.
I get it. I get it. How about you? How have you, over all these years, been able to, let's just call it like it is, right, psychologically get over that hump of knowing what you know in regards to them not always wanting to be there? And I guess the other side of it is that, you've done so much great work for patients in the community, but how have you managed it?
It's funny. I mean, time is part of it, right? I mean, 18 years now, I think, that I've been practicing. And I didn't have it till she started.
Yeah.
That's really true, but I don't think it
Air
was from
traffic
me.
control.
He was just
discuss
younger.
the job, air traffic control.
Christmas is coming up. I'll get you that just for men beard stuff.
Ooh, that's a good
Perfect.
idea.
Yeah, next time we do this.
Yeah.
No. No, I think that part of it is just repetitions and experience and just getting used to talking to people, right? Just meeting them where they are. And, like when I meet a patient now, I always want to know, where are you from? What do you do, right? What are your expectations, right? What brought you into us? Don't tell me it was your car. I know your car brought, I want to know what was it that made you seek us out, and what are your expectations? Because I want to help you with whatever that is. But, I want to know something about them. I want to, and it's like, oh, yeah, I work on old cars. I'm like, oh, cool. What do you have? Oh, I've got a, Chevelle. I'm like, oh, I had a 67 Tornado, and we can talk about wrenching on cars a little bit. But, there's just different things that you have in common with most people. We all have something that we can kind of, agree upon is important to us, and I think making that connection is important. But just finding that connection and just letting them realize, listen, you're not just some dude who's towering over them, while they're laid back in the chair getting something unpleasant done. You're a person too, and you want to know, because I want to know who they are and what makes them tick, and what's important to them, and how can I help meet their expectations, right? I mean, it's all important to me.
Yeah. Here's the thing, like, everybody's living their own life. Everybody's got their own thing going on. You pass people all the time, you don't know if they're having a bad day, but they come to you at the dentist and they tell you, this happened to me today, I don't want to be here. So we automatically know. We're like, I'm going to be your happy person today. And then the second we get in the car after work, we're like,
yeah. Unload everything.
Because you
drive home in silence.
You have to be
That's
there
why I
for
wanted to
them.
ask the question, because I think that there's a lot of behind the scenes that people that do not work in a dental practice that are not in this profession.
Right, but we know you're not having, you don't want to be at the dentist.
Right.
So we're going to make it the best experience that you can. That's what we chose to do this.
Yeah.
We want to be here.
It's funny,
even
like,
if we do need a glass of wine at the end of the day.
But I think it's kind of almost like a compliment over time, because people come in who are strangers to us at first, right? And then we get to know them, and then we end up knowing so much about their lives they share with us, and like we're seeing husband and wife, and then the husband passes away, and just what happens in that relationship with the widow over time. I mean, you just see these things, and then what they share with you. Yeah. It's just one example. It's on my mind from, and it's, but it's also, I think, complimentary that you've built that relationship with these people and they're comfortable sharing these things with you, and they're looking to you weirdly in some way, some therapeutic way
I feel like
to
it
talk through
sometimes
stuff.
is like a therapy session for patients, and I don't know what it is, but they feel really comfortable with just telling us a lot and kind of like getting things out. But I feel like sometimes we are also therapists.
Will you do me a favor on your resume, Natalie? And
Add
put
that.
dental assistant,
Traffic controller.
air traffic controller,
He's
therapist.
definitely giving me a raise after this.
Oh, here we go again. Great.
Well, listen, this has been awesome. I have one last question before we spend some time with the rest of the team. Natalie, I'll start with you. When you look at dentistry over the next couple of years, what are you excited about?
I think like the just continuous technology. I feel like every day Dr. Bewley's is buying some new piece of equipment. I'm like, slow down. We just got something new, but I'm excited to see how they can just
Utilize it.
It's crazy. Yeah. So I'm excited for the technology.
That's cool.
How about you?
Same, honestly. Like, for the education purposes, for the quick treatment, for the precise treatment.
It like helps everyone.
Yeah.
Patients and us.
Yeah, you don't got to worry about sending stuff to the lab through the mail and it coming back something chipped in the mail.
Yeah.
And
Or
it's going to
lost.
be perfect. Yeah, or lost.
Or wrong color.
Yeah, and then you got to wait another 2 weeks. And then,
Yeah.
sorry, your front tooth is going to be black for a little bit longer.
Yeah.
Yeah, I think for me, same, but, analytics and data, AI, who knows what this profession is going to look like in 10 or 15 years when you've got robots that are going to be more able to do some procedurally.
Then he won't have to give me a raise.
Yeah, then I can work from
Hire a
home.
robot.
They can work from
I
home.
always think about that. I'm like, I'll never get to work from home.
That's true.
Yeah,
Maybe we will.
Yeah, but I think that's part of it. But then I think there's going to be a lot of efficiencies that are going to come with the AI and with robotics,
Absolutely.
and that are going to help us lower cost of care for people. We'll be more efficient.
Yeah.
And I really like that. I mean, we build so many systems to try to get different levels of care for different people. Same level of care, but access to care for different
Absolutely.
people is what I mean. And I think that's really what I'm kind of excited about in technology for that reason.
I think it's interesting because I think everything that you all talked about today, it's why I wanted to wait till the end to kind of like, we haven't even talked about AI. We've been here for 30 minutes, but I wanted to do that on purpose because I wanted all three of you to talk about the time that you wanted that was important to build relationships with the patients, because then I think that all this technology, to your point, is going to allow all of you to do that.
Yeah.
And I think that's what's encouraging for patients and for dental practices. And so instead of maybe being a little nervous or scared about the tech, embracing it, because it sounds like it's a lot of the things that you're going to be able to utilize and leverage.
Yeah.
Which is great. So, well, thanks so much, everybody.
Awesome.
Thank you.
Thanks,
Awesome.
Appreciate it.
You got
Thank
it.
you.